Hi, everyone. Thank you for joining SimiTree's webinar. We're excited to have you here. We're going to give everybody just a minute to get into the room and get their audio connected. While we're waiting, just a couple of reminders. I will put the handout link into the chat for you to be able to access. If you have any questions, please don't hesitate to use the Q&A as we're going through the presentation. With that, I'll go ahead and get us started. I'm Missy Gilliland, the Director of Learning and Development here at SimiTree, and today we're greatly honored to have Christy Lang and Mike Simeone here to introduce us to the 2024 Strategic Growth Series. Today we're going to talk about how we shore up your market position. With that, I'm going to turn it over to Mike to introduce himself.
Thank you, Missy. My name is Mike Simeone. I'm Managing Director on the Financial Consulting team at SimiTree. I've been with the organization for just over 12 years now.
Quick math.
Yep. I was just like, it's 2024. Does that mean 13? Yeah. Like, not quite yet, because I started at the end of 2011. Background is in financial consulting, cost reporting, budgeting, data analytics. But I've been doing recently a lot of engagements revolving around strategic planning, which coincides exactly with what we're going to be talking about today, with looking at your market position and making sure you're looking at your core market before you look at growth opportunities elsewhere. And I will turn it over to Christy Lang, my counterpart, to introduce herself.
Thanks, Mike. Thanks, Missy. Hello, everyone. Glad to have you with us today. My name is Christy Lang. I'm the Director of Data Analytics here at SimiTree. Been with SimiTree specifically for about 4 years, but been doing post-acute care data analytics since before the turn of the century, so since the late 90s. I love working with especially home health and hospice organizations, but with healthcare providers generally. And my kind of sweet spot, as I know Mike has an affection for, is thinking about how we can use data to help answer questions and make good decisions to allow you all to focus on what you do best, and that's providing care and having the business operations in place to really support that effort. So like Mike said, this is our 2024 Strategic Growth Series. This is the kickoff. We have a couple of different conversations planned. Today's conversation is really focused on the perspective that you as an organization are really looking to solidify your current market position. Future conversations will be more focused on growth. We'll be thinking about, is it time to grow? What are the opportunities out there? How do you want to think about growth? And then how do you make sure you're having the right conversations to set up the most successful growth plan possible? So without further ado, since we have a tight timeline today, we're hoping to pack a lot of information into just a half hour here. Let's get started. I will say, I think Missy mentioned before, for those of you who didn't hear it, we would love to hear any questions that you have via chat. We'll do our best to save time for those, but if we have anything that comes in either via the chat or the Q&A that we don't get to, we'll make sure to follow up with you later. So every organization is unique. You have a unique set of circumstances, you have a unique market, you have individual drivers, team strengths, all those different components that really speak to what's going to be most useful for your organization going forward. But generally speaking, when we're working with home health and hospice organizations who are really looking to solidify their current position, they aren't worried so much about growing as an organization, but they want to make sure that they aren't going to be losing market share. We think about 3 key elements. 1 is truly understanding your competitors. 2 is validating and reinforcing your market position with current referral sources. And 3 is kind of thinking about what is our buffer, where there may be potential additional referrals to be had in case you see any erosion in your existing referral sources. So we're going to be talking about each of these 3 areas in detail today. And we're going to be focusing on some data that we make available through our claims-based market analysis program called MAP. The market analysis platform. All these sample reports that you're going to see here are focusing on the underlying information that helps you drive the decisions that you're going to be making, but they're all coming from that application in case you're curious. So step 1, understanding your competitors. Who are they and who are they really? Often we're talking to organizations who have a few competitors in mind, but they don't necessarily have objective data that tells them that those competitors are the folks that they are really competing against in the real world on a day-to-day basis. So step one in our activities working with clients is figuring out who are your competitors specifically. What does their market share look like today? How has that market share trended over the last few years? Are there folks who are coming up or losing market share? And how does that insight influence the way we think about operating in our space? So what you see here is a list of potential competitors. Again, this is a real report, but we have blinded the names of the organizations involved just because we don't want to call anyone out. But the idea here is that you can see who are the specific competitors. We've highlighted the top 10 here, and you can understand what their current market share looks like within a specific market and how has that trended over time. I want to highlight a couple of ideas around changes. So one of the key things that we're looking at when we're thinking about competitors is, first, if you understand exactly who you're competing against today, and maybe who you were competing against last year, the next question is, how have things changed within your market? So in this particular example, I can highlight that the top competitor in this particular space lost market share in 2021, but then they have come back up to the market share that they had in 2020 in the first half of 2023. So understanding that this particular agency lost market share in this particular community overall, but then gained it back over time is an interesting aspect to the dynamics that are going on within this market. But if we explore the market further, we might see other information that is really informative as we think about how an agency within this space might think about positioning themselves. So here we have an agency that is currently the third largest in the market, but came up from 7th position just a few years ago. In 2020, they had just 5% market share. In the first half of 2023, they have 13% market share. That's a notable gain in just a few years' time. Now, depending on the particular market, this could be a more common occurrence, or it could be really rare. Sometimes we see a lot of shifting, sometimes we don't see a lot of shifting. The top 10 stay virtually the same year after year. But understanding that we have this competitor that has come up in prominence so much in such a short amount of time tells us that there are changing referral patterns in the community. And we might want to dig in to understand why this particular agency has increased in prominence so much in such a short amount of time. Another example here, we have an agency that is currently the 9th largest in the market, but came up out of almost nowhere. 0% market share in 2020, 3% market share in the first half of 2023. What are they doing? Who are they targeting? How are they approaching referral sources? How are they presenting the care that they provide to patients in the community that makes them so successful in this community? Those are all questions that might help us think about how we position ourselves if we were in this competitive environment. And one last example, sometimes we also see the opposite dynamics. Here is an agency that dropped from 10% market share in 3rd position in 2020 down to 7% market share in 7th position in the first half of 2023. Again, understanding what's going on there and trying to predict how these current trends may translate to future market dynamics and referral patterns can be useful for informing where we want to focus going forward. Mike, before I move on, any observations you want to add in?
One thing is, I love the 4 different providers that you identified with their changes. But one thing, just looking over the overall landscape of the competitors in this market, is this is a market where you may want to even look beyond just the top 10. Because no one has a dominant market share, right? The largest is, as of Q2 2023, is at 18%. That's not what we would consider a dominant market share. A lot of times when there's partner hospitals or health-based, system-based providers, someone has 70, 80% of the market if that is the primary referral source to home health or hospice as the indicator. So there is a bit more volatility in this market because there's a lot of players, a lot of viable players competing over a similar referral. And, the ability to understand what referral sources are referring where, which I'm sure we will drill down into later in this presentation. But that's definitely something to look at in this particular market. Is there's a lot of volatility, 4 different providers with pretty significant changes between 2020 and 2023, and a lot of people going after the same market share, probably across the same referral sources without anyone really dominating the market.
Speaking of, next conversation point is, as an organization, truly understanding where your referrals are coming from, generally speaking, and specifically from which providers. So what we've got here is illustrated the idea that we're evaluating where are we getting our referrals as either a home health or a hospice organization. Are we getting our referrals predominantly from hospitals, from skilled nursing facilities? As a hospice organization, you may be getting a lot from home health agencies or from the community, which are direct physician referrals. Generally speaking, understanding what that mix looks like for your organization and potentially for your top competitors can be useful in thinking about how you move forward, as well as understanding those specific providers. So here we've illustrated for an individual organization, their highest referring hospitals, where they're getting their largest volume of hospital referrals, and which physician groups, which can be drilled down to individual doctors, are contributing most to those community referrals. I want to make one note of something that we've really been taking a closer look at lately and is highlighted by the pie chart on the left-hand side. Here we have hospital with referral and hospital without referral. What we differentiate here are patients who are discharged from a hospital with the hospital discharge status of to home health or to hospice versus those patients who are discharged from a hospital with a discharge status of to somewhere else, but they still end up admitted to the home health or hospice organization. The reason that we're differentiating those two is that that can sometimes influence conversations with the hospitals in a community. If we see a lot of those referrals from hospitals coming, or a lot of those admissions being patients who were in a hospital prior to home health or hospice, but without the referral, we may have an opportunity to influence the conversations with hospitals to think about where they're discharging their patients to, and maybe short-circuiting some of the ambiguity that patients have after being discharged from a hospital. Let's say they're discharged home with no post-acute care, referred directly out of the hospital. There may be a delay in receiving the services that are most appropriate for them, although they may end up there eventually. So if we can understand how often our hospitals are actually referring to home health and hospice versus discharging patients who eventually end up in home health and hospice, that can influence the way we approach those referral sources and potentially get patients what they need faster. This is information that even if you don't have external data coming at you, if you're tracking this information internally, you can do this same sort of analysis. So you can think about where the patients are coming from for your organization specifically, if you're working mostly with hospitals, with physicians, with skilled nursing facilities or home health agencies. Understanding that mix of your referral sources and then who specifically are the primary sources of referrals helps you identify who you need to focus on most for solidifying your market position today.
Yeah, in addition to this, this is how we would recommend you rate your accounts, A, B, and C accounts for your sales, business development, sales staff. So as you're assigning referral partners to your business development teams internally, you want to look at where your volume sits, where your most important relationships with, and you don't want to give all of your A accounts to one individual. You want to distribute your A accounts, your B accounts, and C accounts. And this allows you to do that not only across hospitals, but those skilled nursing facilities, those physician groups as well, to identify and make sure you're giving everybody and giving opportunity on those, when you get further down this list, because I wouldn't say anyone here is a C account, but opportunity for your business development team to move some of those C accounts to B accounts, B accounts to A accounts, and trend this over time to see, oh, this individual is a high performer. And then also when you're looking at that, using this to develop incentive compensation models as well for that team as they build more referrals and admissions and grow your organization within your current market.
And we're actually going to talk a little bit more about A, B, and C accounts in just a moment, in case those are kind of unfamiliar terms to you. But before we got to that part of the conversation, wanted to think about one other piece of data that can be useful in thinking about referral sources and solidifying your position with current referral sources. That's understanding specifically who you're competing against for referrals from those high volume referral sources. So if we've identified that Abbott Northwestern Hospital, for example, I think they were the second highest source of referrals for this particular agency, we might want to focus on them as a high volume account. And in that, thinking about protecting our referral business from this particular hospital, who else specifically are we competing against and at what volume? So getting into that level of detail where we understand that distribution of referrals and the specific volume of patients that are represented by that distribution can be useful in informing those next conversations. Similarly, as we're thinking about our referral sources, just understanding how they refer to home health and hospice today and what their patient mix looks like can be useful in approaching those conversations. So here is an example of looking at a particular hospital, the volume of patients that they are discharging to home health and hospice, and how that compares to both local and national benchmarks. If we have a hospital who is already discharging a lot of patients to home health and hospice, there's a conversation about why your home health and hospice that is going to have a lot of weight. If you have a hospital that is maybe under referring to home health and hospice, and by under referring, I mean having a lower volume of patients discharged to home health or hospice relative to others in the area, other hospitals in the area, perhaps that conversation is not just about why you, but also about making sure that those patients are getting the appropriate level of service. Maybe more patients are appropriate for referral to home health and hospice than what they're discharging to that post-acute care setting of care today. Those are two different conversations, similar in nature. They certainly overlap, and there is always value in talking about why your home health agency or your hospice. But if an organization is discharging or a hospital is discharging a large volume of patients, maybe to home or self-care with no post-acute care, maybe to skilled nursing facility today, perhaps there's an opportunity to get a better level of service for those patients by going straight to home health and hospice. The other thing to consider as we're thinking about the referral source and the types of patients and how they interact with post-acute care today is thinking about the mix of patients that they're discharging to home health or hospice. So the bottom graph or the bottom table is an example of where we're looking at the total volume of patients who are discharged to home health, and then what clinical groups those patients fall into once they're admitted to home health. So that tells us, is this particular hospital discharging an especially high volume of cardiac patients or MS rehab patients or surgical aftercare patients? If they tend to focus in a particular area, then by gearing the conversation around how you can serve that particular patient condition, that type of patient need, can be helpful in positioning yourself with that referral source.
And data-driven conversations assist with that, right, Christy? When you're looking at cardiac patients out of a specific hospital or MS rehab, showing how you are preventing rehospitalizations among that specific patient base, showing how your patients have quality outcomes on that specific clinical group. You're improving their ability for MS rehab to ambulate, to bed transfer, for example, really, leveraging not only this market data, but your internal data on that specific patient volume. That's going to be significant and of value to that hospital. They want to see those positive outcomes, and more importantly, they want to see their patients not ending up back in their own hospitals. So that is what you want to bring in when you're bringing this, in addition to patient satisfaction, that you won't be able to really quantify by the clinical group or patient distribution, but you can definitely look at rehospitalizations by those specific clinical groups and even drill down even further to diagnosis level to add value to those conversations as you're trying to become the preferred partner for some of these referral sources in your core market.
Yeah, that's a great example. And kind of the counter example of that, let's say you have a great behavioral health program. If that's what you lead to with Abbott Northwestern, either of these two hospitals, you may get met with a stone wall because they don't have a whole lot of behavioral health patients that they're discharging to home health, right? So you have limited time with these referral sources. Let's focus on what you do well, but also what they care about. All right, so here's where we start to think about strengthening best relationships, and that concept of A, B, and C partnerships or referral sources. I'm going to just go ahead and pop this all up because we've already kind of talked about this whole concept of A, B, and C referral sources. To introduce you to the concept quickly, because we do have a limited time here today, and we have much longer conversations available, training sessions available if you're interested in learning more about managing the sales process and thinking about devising a strategy for organizing your referral sources and how you work with them. Here is just the tip of the iceberg. We think about categorizing referral relationships into A, B, and C based on volume and referral relationships. So volume dictates how many patients may end up eventually in your organization, being cared for by your home health or hospice. Those referral relationships speak to what percentage of those referrals are coming to your agency. So both of those can go into place in thinking about categorizing your referral relationships into this A, great, B, good, or C, kind of non-existent or developing, if you will, category. And as we're looking at this data, that data informs the categorization into each of these three groups, but it also helps prioritize where you're investing your time and where you're investing your people. And like Mike said, even how you're distributing your accounts across the folks that you have out in the market. So regardless of who you have in your space, how many individuals you have really having those conversations, we want to be thinking about what is your position with those referral sources today, like we were just talking about with the data. Is there room to grow? So with some referral sources, that may be about increasing the volume of patients that they refer to home health and hospice overall. So maybe they are sending a lot of patients to skilled nursing or discharging a lot of patients home with no post-acute care. We may be able to increase the size of that pie, or perhaps we're getting fewer of those referrals than possible. So maybe we're at 40% with a particular referral source, and we think we can get to 60% with that referral source. The focus may be more on increasing the volume of referrals that are coming to our agency versus increasing the size of the pie overall. So is there room to grow? Who are you competing against specifically? Because that knowledge is going to help you best position yourself in those conversations. You don't want to focus necessarily on a strength of yours that is also a strength of your competitors, and they can come back and maybe even say they're stronger in that particular area. But how do you differentiate from your competitors with that referral source today? Thinking about how you can move accounts from the good relationships to the great, so the B to the A, or maybe even from the, hey, we're familiar with each other, but like, let's start getting some referrals going, move them from a C to a B category. And then the other big question that I know Mike and I are both big on, it's depending on your perspective, but we both tend to be risk mitigators, is where is their risk? Where do we have an awful lot of referrals that are coming today and maybe an up and coming competitor who might be threatening our position with those referrals going forward? And where do we need to reinforce those relationships?
And, we see this at agencies happen from time to time. Are those referral relationships built on the business development individual in that role? And if you lose that individual, what happens to that relationship? And then building those relationships beyond, especially for your A accounts, just the business development team, but to your senior leadership as well. So the relationship is with your organization, right? Your home health, your hospice provider, in this case, and not with the individual. Because when we looked at that original data, seeing an agency go from 18% down to 13%, that immediately from 20 to 2021, the first slide we showed, I'm curious what happened there. And what's the root cause analysis? Was that because you lost your business development individual with one of your A accounts and you lost 5% of the market in aggregate because you lost a significant amount of market share at one provider because there was too much tied with one individual in those roles? And it's building that relationship across the team. Yes, you're assigning that business development rep that A account, but those A accounts should have relationships that go beyond business development to senior leadership. Just as an example of a potential risk mitigation tactic here, there are other risks that mentioned competitors, strengths, whether it be timely initiation of care, rehospitalizations, et cetera. Where do you differentiate and where you can mitigate those? Thank you, Missy, for letting us know. We've got 5 minutes left, so I'll stop talking and let Christy continue.
All right, let's get to a couple of other quick concepts here. So luckily we are kind of pivoting into the last section of the conversation, and that is thinking beyond really specifically reinforcing your current market. We've talked about making sure you understand where those referrals are coming from, making sure you understand the dynamics of the market overall, and then focusing on the relationships with your key referral sources. But what if you do see a threat coming up? Or what if you are really looking for some risk mitigation and you want to make sure, you're focusing on keeping those referrals, but you also want to have a little bit of an insurance policy and perhaps start exploring other referral avenues, even if your intention isn't necessarily to grow significantly as an organization. One of the things we have a lot of conversations about is just identifying where are those referrals coming from today. And one of the paths to identifying new referrals is understanding we compete really well against this particular agency. We have this list of unique capabilities that really resonate with our referral sources. And when we go head to head, we tend to win a lot of those conversations. So perhaps we look at where that other agency is getting their referrals today. We might want to understand who are their highest referring hospitals, physicians, SNFs, home health agencies, physician groups overall, and target conversations with those high referring sources for that competitor today. Perhaps we can buffer ourselves with receiving some portion of those referrals going forward. We also might want to just look at where are the largest sources of referrals to home health, identifying those hospitals that refer the highest volume of patients to home health in our core areas, or maybe areas where we have capacity. So we might service 3 or 4 counties, but really be limited in capacity in 2 of those and have a little bit of wiggle room in another. And we want to identify exactly who is referring patients to home health service in that particular county. Just understanding who's driving the volume there, and then who is receiving referrals from those organizations today, figuring out if there are current owner relationships or strong signs of loyalty where it might be easier to compete in a situation where they don't have 70 or 80% of their patients going to a specific home health agency. Can be useful for figuring out where we potentially create some of that new opportunity. And then finally, if you're thinking about building a specialty program, that can be a unique competitive differentiation in your market, or perhaps leveraging some existing strengths in your organization. So maybe we want to think about building a focused clinical program, and in that capacity, understanding where are the patients being discharged that fit that clinical profile, so that we are making sure to promote the strength in that area to the organizations that really care about it, because they have a lot of patients who could use that service. So just kind of wrapping up here, and I haven't kept a good eye on the chats. Okay, it looks like we don't have any questions coming in. If you have any questions, certainly we have contact information here. We also have our contact information in the handouts that you've received from Missy. But if there's anything that SimiTree can do to help you achieve what you want to achieve in 2024, 2025 and beyond, maybe tapping into our expert guidance, getting some help with strategic sales and marketing planning, getting access to this data for your own organization, optimizing your operational efficiencies. Essentially, if there is something you're struggling with in home health or hospice, SimiTree has an expert on hand who can help you with it. And we'd love to have a conversation about that. And there is how you can get in touch with us at our website or phone number. And to wrap it up, right on time, here's our contact information. And just to hear pitch our next market strategy conversation about thinking about potential expansion. How do you know if it's time to expand, and where do you think about doing that effort if it is? So that's going to be on February 2nd, and same time, same bat channel. So like I said, yeah, Missy, you want to wrap it up?
Excellent. Thank you so much, Christy and Mike, for sharing such great information. Like Christy and Mike both said, if you have any questions, we're here to help you. Christy and Mike's contact information is on here for you. Feel free to reach out at any point in time. We'd love to hear from you. With that, have a wonderful Tuesday, and we'll see you on February 2nd. Thank you all.
Thank you, everybody.
you.
Thank you, Missy. Thank you, Christy.
Yeah, thanks to both of you too. Talk to you soon.
Bye.
Bye.